Today, we're jumping into one of the most complex and, honestly, one of the most critical structures in your entire body, the cervical spine, or, your neck. We're going to break down this incredible piece of biological engineering, and trust me, it is an absolute marvel.
So let's just get right into it. The whole design of your neck is this constant, delicate balancing act. It has to be unbelievably strong to hold up your head, but at the same time, it has to be flexible enough for you to see the world. It's a perpetual tug-of-war between two big demands, stability and mobility.
And just think about that for a second. Your neck is supporting the weight of a bowling ball all day, every day. It's an incredible feat of engineering. And it's why our source material says that, in the neck, stability has basically been sacrificed for mobility. And that exact trade-off is what makes it so uniquely vulnerable. Okay, so to really understand this marvel, we've got to start our tour at the very top. We're talking about a region called the cervicoencephalic area. This is where your skull meets your spine, and it is, for all intents and purposes, the command center for your head's movement. What's so cool about this area is how specialized the top two vertebrae are. They're so special they even get their own names. You have C1, the Atlas, named after the Greek titan who held up the heavens, because it literally holds up your head. Then right below it, you have C2, the axis, which acts as a pivot, letting the Atlas and your head rotate. So every time you nod yes or shake your head no, you have these two to thank. So the bottom line is, this upper region is built for maximum movement. Get this, about half of your total head rotation happens right here, between these two bones. But because it's so mobile and because it sits right next to the brainstem, any little problem up here can cause some really widespread and confusing symptoms, like headaches, dizziness, even trouble concentrating. All right, let's travel down the spine a bit. We're moving into the lower part of the neck, what's called the cervicobrachial area. This is C3 down to C7. Now, if the upper neck is the command center, think of this section as the workhorse. This region handles the heavy lifting and connects everything to your shoulders and arms. And this is just a perfect way to see the different jobs these two areas have. The upper neck, its main job is moving the head itself, so problems up there usually lead to things like headaches and balance issues. The lower neck, on the other hand, its job is bending the entire neck and sending signals down to the arms. So problems down there, that's when you typically see neck pain and arm pain. Now, because this lower region does so much work, so much bending and supporting, it's where we see the most wear and tear. And there's one spot in particular, right between the 5th and 6th cervical vertebrae, that handles the most bending forward and back. This makes it the most common place for age-related degenerative changes, a condition called spondylosis. But of course, the neck isn't just a stack of bones, right? It's also a critical highway for the lifelines that connect your brain to the rest of your body. So we're going to look at two of these systems, a major blood vessel and, well, the body's wiring. First up is the vertebral artery. It supplies a huge amount of your brain's blood supply, and as you can see, it takes this really twisty, winding path up the neck. And that path, especially the sharp turns it makes at the very top, makes it really vulnerable. Our source material points out that even simple, everyday movements like turning your head or looking up can put stress on this artery. And these are the alarm bells. You have to know these. If that blood flow gets messed with, it can cause some really serious symptoms. Dizziness that's tied to neck movement is a huge one. So are things like drop attacks, vision problems, or ringing in your ears. These are signs that mean you need to get checked out immediately. Okay, the other critical system running through there is the network of nerves. And here's a great little piece of anatomy trivia from our source. You have 7 cervical vertebrae, but you have 8 pairs of cervical nerve roots. So wait, how is that possible? Well, it's because the very first pair actually sneaks out above the C1 vertebra, right between your skull and the atlas. Pretty neat, huh? So with all of this complexity, you've got bones, arteries, nerves, all packed into this tiny space. How on earth does an expert figure out what's going wrong when something happens? Well, it isn't guesswork. It's a structured investigation. It's like detective work, really, connecting the anatomy to what you're actually feeling. And the whole process starts with listening, your story, how it happened, where it hurts, what makes it better or worse. That's the single most important clue. From there, a clinician will just look, observing your posture, seeing how willing you are to move. And only then do they carefully test specific movements to really home in on what's causing the problem. Now, during this entire process, clinicians are also on the lookout for what they call red flags.
These are signs or symptoms, like the ones you see here from the source material, that suggest something much more serious might be going on underneath, something that might need immediate attention.
So, really, the key takeaway here is that a proper assessment is all about connecting the dots. It links your personal story, your symptoms, to the specific, intricate anatomy that we've been talking about. And that right there is why a professional evaluation is so incredibly important. You need an expert guide to navigate this map.
And we'll leave you with a final thought on all this. Your neck is a true marvel of engineering, constantly balancing incredible strength with delicate mobility. After seeing just how complex and fragile it is, it's worth asking yourself, how am I supporting the structure that does so much to support me? Maybe it's as simple as just paying a little more attention to your posture today.